Okay. Okay. Hello. This is my clinical case presentation. For this assignment, I'm presenting a pseudo-patient based on publicly available information and self-disclosures. It's not a real clinical diagnosis. Today, I'll cover identifying information, the presenting problem, relevant history, my diagnostic my diagnostic impression using the DSM-5 criteria, and as well as a brief conceptualization. Now, for our patient, this case focuses on Lady Gaga. Lady Gaga is a 38-year-old woman who is a world-famous singer, songwriter, and as well as a performer. Her job includes very high energy live shows that are very demanding. She is a very theatrical performer especially within her last tour. She had many scenes within her tour, which are long, very intense and thought out very well. Um, with these come intense rehearsals. She often is frequently traveling, either for tour dates, performances, or different award shows. She's also under constant media exposure. She has to perform for large crowds and stay on socially and emotionally, even when she's overwhelmed. So, with that, here's an image of the Lady Gaga herself performing in Indio, California. This was her first night of her Mayhem tour for Coachella in Indio, California, where she debuted her incredible tour with many different scenes, many different theatrical, components, different um, props that she's using, like this skull kind of piano, decorative piano with skulls along it. Now, that all of her history, her personal information, that context matters because her work environment um, can intensify stress and increase exposure to triggers. So, oops. Presenting our problem, why she's seeking psychological services. So she presents for psychological services because over the past several months, she's noticed an increase in trauma-related distress. Now, this distress is interfering with her daily functioning, her ability to perform consistently, to put her all into her work. She's a very passionate artist, and the trauma-related distress that she's experiencing has been putting a strain on her and her ability to perform. So, like pictured in this photo, she is an incredible artist, but she's also always doing very large theatrical events. So this is her in an extremely enhanced dress that she's sitting in the middle of her concert. And this is just one of the many things that she's doing in her concert that can, bring stress with her. She reports intrusive memories and nightmares, and she describes feelings emotionally flooded. When she's feeling emotionally flooded, she can't shut her mind off. She has a very hard time turning off her emotions and her thoughts to be able to wind down, to calm herself down. She has a very hard time doing that, especially when her emotions are flooded. She also endorses hyperarousal, like feeling on edge, sleep difficulties, irritability, and being easily startled, especially when her work stress is so high. Her work environment is incredibly demanding. Um, Anyone at that caliber has so much going on, and she's always at an all-time stress high because of the amount of stuff that she's constantly doing. Um, Her main concern is that she's worried that it is now affecting her sleep, her moods, her concentration, and her performances. She's worried about potentially losing control during rehearsals or live appearances. And these concerns are very, they can impact her career a lot, especially if, something were to happen and it's in a negative connotation. The public eye can see that and really just go ham on her character and kind of degrade who she is when in reality she was just having a really hard time that evening and it can be taken out of context. So these situations where she's worried about her performance or who she's, portraying on stage, they can cause her a lot of stress. So she's trying to learn and trying to really understand how she can manage these triggers so she can function effectively, both professionally and personally as well. Next, I'll kind of give you the key background of her background factors that support the diagnostic impression. So with this, we have our relevant histories. We have medical history, we have psychological history, and her occupation history. Starting with her medical history, Lady Gaga does have a history of chronic pain and fibromyalgia, which at times can flare during high stress periods and demanding schedules, affecting her sleep, energy, and daily functioning. It has required periods of focused recovery and medical management. Her fibromyalgia really flares up when she's under a lot of stress and it causes pain throughout her entire body. Um, an important piece to add to this, Lady Gaga was on Oprah's tour, I believe couple years ago, and opening up on this tour, she kind of talked about her mental health, her medications, her PTSD, and her fibromyalgia. With all of this, she really talked about how her fibromyalgia is heavily, heavily influenced because of her mental health. So if her mental health is not in the greatest point, if she's under a lot of stress, if she's feeling a lot of these panicky, triggering emotions, it really allows for her fibromyalgia to flare up because they're directly connected for her. Moving on to our psychological history. Our patient has publicly described a history of traumatic events, experiences, and disclosed that these developing post-traumatic stress symptoms, like um, her strong physiological reactions and emotional distress, are all tied to trauma reminders. Um, as an occupational history, she works in an incredibly high demand, high visibility environment that requires lots of travel, lots of rehearsals, performances, interviews, and unpredictable contact with other people when she's either doing interviews on red carpets in the public eye. All of these, instances, they can increase trigger exposure and also can reduce her consistent recovery time. So if she's, taking on all of these things, she has a lot harder of a time to focus on herself and manage her own mental health while she has all these other major events going on. Now, with that context, I'll move on into my diagnostic impression. My primary diagnostic impression is post-traumatic stress disorder, otherwise known as PTSD, within the DSM-5. Based on the reason that PTSD fits best is that her symptoms cluster into the major systems of the PTSD domain, um, such as intrusion, avoidance, negative mood cognition and changes, her hyperarousal, and they're clearly impacting and functioning. Based on her reports, the symptom pattern fits best with the PTSD, um, because of all these different things that are happening on within her daily life and work. Now, with these, I will connect the symptoms directly to our DSM-5 TR criteria. Now, for the diagnostic impression with our DSM-5 TR criteria, I have several different criterias that I kind of dived in with all the different reasonings for each. For starters, we have criteria A, trauma exposure. She reports a history of traumatic experiences that, this case is built around that exposure being present, whether she's performing, whether she's doing her rehearsals, traveling for work. All of these opportunities that she does for work can bring a trauma reaction. They can trigger her traumas and kind of remind her of what's happened in her life. So during all of these different things, she has all these opportunities that can trigger her trauma, which can ultimately affect her mental health. It can affect her fibromyalgia and especially with her PTSD. Um, for criteria B, her intrusion symptoms. She has recurrent intrusive memories and nightmares, strong distress when reminded of the trauma. So again, when she's out doing her work when she's in the public eye and something she sees either in the media or when she's out, being portrayed by the media, she has oftentimes strong distress when things can remind her of her traumas. And with these, it comes with trouble sleeping for herself. She has intrusive memories that kind of flash back for her. Um, she has chronic nightmares that happen because of these distresses and when she is reminded of this trauma. And for criteria C, we have avoidance. For avoidance, she increasingly avoids certain situations or topics that might trigger reminders, like specific interviews or settings. So because of this, her avoidance that she has, she's publicly spoken on how she avoids different interviews, interviewers. She avoids certain situations, maybe on the carpet, maybe being interviewed by different people. She has a clear policy on what she talks about, what they are allowed to ask her, and what she will answer. And because of that, in a way, she's looking out for herself, but she's also avoiding other topics to prevent such triggers because of different situations and environments. Even when she's out being interviewed, she may overhear someone else's interview and it may be a trigger for herself. So she's gone through times where she will avoid going to red carpets altogether, or she'll avoid doing interviews altogether, all just to kind of escape that harmful environment that could potentially be there because of different situations or interviews in different settings. Um, thus ultimately being criteria C, avoidance. Now for criteria D, we have negative changes in mood and cognition. She's describing ongoing distress and emotional flooding with a reduced ability to kind of feel calm or safe. She really struggles with when the situations are happening where her stress is ultimately very high and when she is having trouble kind of coping with her stress and kind of getting down to a safe point. She has a really hard time feeling calm and safe because her occupation and her work, like in her work life, is so incredibly stressful that her managing that stress has been impacted, and it is incredibly hard for her to feel calm and safe, especially when her mind is struggling with the emotional flooding. She has a hard time redirecting those emotions and kind of figuring it out and separating them and kind of allowing herself to feel calm and safe in those situations. Thus, criteria D, her negative changes in mood and cognition. We also have criteria E, which is our arousal and reactivity. Within our arousal and reactivity, we have feeling constantly on edge, sleep disturbances, irritability, exaggerated startle, and difficulty concentrating, especially under stress. Um, she has a hard time kind of winding down again. She has a really hard time with her sleep and kind of getting that figured out and calming down. Um, with these symptoms, they have been going on for months and are interfering with her sleep, her mood, her concentration, and performance. Thus, kind of tying in with criteria D, which is her duration. They've been described as lasting over a month. With criteria G, we have distress and impairment, thus interfering with sleep, mood, concentration, and performance reliability. She's specifically seeking help because the functioning of these things have been so heavily impacted because of her symptoms. So that is within her criteria G. Next, I'm going to explain how, these symptoms are being maintained using a brief clinical conceptualization. Now, for this, we have our diagnostic conceptualization for post-traumatic stress disorder, PTSD. On this slide, we have an image of Lady Gaga winning her Artist of the Year at the 2025 VMAs. This picture, I think, is incredibly relevant because as she's accepting this award, as soon as she accepted her award and finished and walked off stage, she was immediately walked out of the building and put onto a helicopter to then fly, I think it was like an hour or so on her helicopter down and then to perform one of her tour stops, which was nearby. But before she did her performance, she went did the red carpet. She got her award for winning the Artist of the Year and then went on right after she had accepted it. She's the first one of the night because of her tour. As soon as she accepted it, she had left, gone, and then performed for her tour, which any, you know, person doing those things, it's incredibly stressful. You're under an extreme time limit. She has to make sure all the variables are correct and everything is going smoothly. So I just wanted to, kind of add that fun little snippet of her with the high stress levels of her career. Um, so for my diagnostics conceptualization, I conceptualize that this is as a PTSD maintenance cycle. Um, Trauma reminders like certain questions, crowd, unexpected interactions, or high pressure events can trigger this distress. Um, her intrusive memories and a strong body response. Avoidance helps short term, but likely maintains symptoms over time. Biologically, her chronic pain and fibromyalgia, um, her disruption can lower stress tolerance and intensify irritability and hyperarousal, while her PTSD arousal can worsen sleep and physical tension. So those factors can kind of reinforce each other. Socially and occupationally, you have her career that involves frequent travel, intense rehearsals, and public exposure, thus increasing triggers and reduces routine, recovery time, limited privacy and control, which can also add to hypervigilance. Finally, you have her public pressure, which may push her to push through and mask distress, which can delay her recovery. Protective factors include insight, willingness to seek treatment, support sources, and motivation to improve sleep and as well functioning. With that, that concludes my case and summary of conceptualization. Thank you for your time. Thank you.